Okay.
Yes.
So, hi, Janet. I'm Karl Portz. I'm the Equality, Diversity and Inclusion Lead here at Northern Lincolnshire and Goole NHS Foundation Trust. I'd just like to really thank you for doing this presentation for us. So do you want to introduce yourself and then go through the presentation? Is that all right?
Yes, that's fine, Karl, and thank you so much for inviting me. It's really important to me to get awareness across. As you said, I'm from Prostate Cancer UK. I'm a volunteer. I have been for the last 10 years, since my husband died of prostate cancer. In those days, we didn't talk about things like that. We didn't talk about men's health or anything down there. Now, because so much has changed, so much has improved over the last few years, we're talking more about it. But more importantly, I think we talk now so much more about living with and after prostate cancer and not dying from. And that's because of all the awareness that we've been doing that's out there now. Currently, the situation has been very bad over the last few months because we've missed a lot of men that should have been diagnosed. We've had to switch from going into workplaces to give these awareness talks to doing it virtually.
Yeah.
But it's really important that we catch those men at risk. So thanks for giving me this opportunity. I always say if one man or somebody from our family gets him to the doctors and gets him diagnosed in time, it's been more than worthwhile spending the time doing it. So I'll move on to the presentation and we can have a look at who is most at risk and what to do about it for either yourselves or loved ones.
That's a really good point as well, Janet, because 80% of our staff are female. So we've got 20% males in our organisation. However, whilst we've got 80% of the staff are female, they've got partners at home, they've got fathers, they've got males in their lives. So I think it's really important that we promote that message in that way as well.
Yes, I agree entirely. It's so important because if things go wrong, if somebody misses a diagnosis, the whole of the family are affected. It's so important. So right. Move on to this the slideshow.
Yes.
Important to know your risk. It really is. Can't say that enough. But also to know your prostate or what a prostate is and who has them. So what is it? There's the diagram there which shows the prostate sat just underneath the bladder with the urethra running through it, which is what a man urinates through. So that's why when often you hear of men dashing to the loo a lot, those sorts of problems, it might be because there's a problem with the prostate, if it's enlarged or for any reason pressing on the bladder. Important as well to say at this stage that the only person that can actually examine a prostate is a doctor because of where it is. It's right inside the body. And so I do often hear of men getting mixed up with testicular cancer, checking testicles and thinking that they're okay because there's no lumps or bumps. Only a doctor can feel the prostate. And so it is important to make sure that you know whether you or a loved one is at risk and to get the appropriate tests. So the following people can have a prostate, and that is men, trans women, non-binary people assigned male at birth, and some intersex people. So we know now where the prostate is. Oh, forgot to say what it is. Its main job is to help to make semen.
Right.
So moving on, what can actually affect the prostate? It's really, really important to say that it's actually quite likely, if you think you might have a problem with your prostate, that it's more likely to be something other than cancer. And I know it often worries men if they think they may have a cancer diagnosis looming, and they put off going to the doctors. When eventually they have to, they're quite likely to find it's either an enlarged prostate or prostatitis, which can both be relatively easily treated. So firstly, an enlarged prostate happens to so many men, and usually from about the age of 50, prostates start to enlarge and can be easily treated. Usually a course of tablets or at most minor surgery is all that's needed. Makes a man far more comfortable and is well worth making sure that you've got to the doctor and got that sorted. The other thing that it could be is prostatitis, typically in men between the 30s and 50s, but can actually be at any age, and that is an infection or an inflammation of the prostate, and again can be treated and can also stop all that worry. But the third thing that it could be is it could actually be cancer. Important to keep having tests if you think you are at risk, because now, as I said earlier, if early, we quite often find that a man can live with and after prostate cancer. It's not the death sentence that it often was in recent years, and certainly when my husband died from it. So it is very important that we catch it early and that we get it treated if it needs treatment. And there's a lot of prostate cancers will be diagnosed that will never ever cause a man a problem in his lifetime, that won't grow, or maybe won't grow for several years. And so if it's diagnosed and the doctor says, let's just keep an eye on this, let's keep testing it every 3 months, every 6 months, then that is a really good scenario, because the some of the treatments for prostate cancer can be quite intrusive. It's possible that some of them can lead to incontinence and impotence at some degree. Now, if that's going to save your life, then it's often a risk worth taking. But if your cancer was never going to grow, never going to cause you those problems, it's better just to keep an eye on it and treat it if it needs to be.
Okay.
So moving on to a man's own particular risk. Certain men are more at risk than others. So if I have a look at who they may be. In the UK, 1 in 8 men will be diagnosed with prostate cancer at some time in their lifetime. The men most at risk would be if there's a family history there. So if a man's father, brother, grandfather, uncle has had prostate cancer or has it now, then the risk increases. So it's very important to know that and to get checked out. Also, we found in recent years that there can be a link with breast cancer or ovarian cancer. So if female relatives have been diagnosed at a young age with breast cancer, say under the age of 60, then there may well be an increased risk. So well worth getting that checked out too. And thirdly, secondly, black men are at an increased risk. So 1 in 8 in the general population will be diagnosed at some stage in their lifetime. For black men, that increases to 1 in 4 men. So really, really important to get that checked out. We don't as yet know why. It's very, very likely it's genetic, but until we know why, we just need to be aware and make sure we're checked out in time. So family history or black increases the risk. The age at which prostate cancer is often diagnosed is from the age of 50.
Yeah.
It can be diagnosed at a younger age, but it's usually more like 50 and over. And as a man's age increases, the risk increases. So they're the main areas we need to be aware of. Family history. If you or a loved one is a black man or from the age of 50, really make sure that you get tested or get your loved one tested. So does it have any symptoms? It can have, often it doesn't have. My husband was diagnosed advanced stage and he hadn't had any symptoms.
Right.
But if there are symptoms, they're usually, as we saw earlier, the prostate is next to the bladder with the urethra going through it. So if there are symptoms, they're usually urinary, needing to dash to the loo more often, being woken up in the night, difficulty when you get there, weak flows, needing to rush, dribbling, feeling that your bladder's not emptied properly. Anything that can really be an effect of that prostate being enlarged and pressing on your bladder. Can be lots of other symptoms, almost anything can be, but anything that you know, I think it's important to say, as with all cancers, anything that's not normal for you, get checked out.
Right.
So, but can't stress enough, most men with early stage prostate cancer have no symptoms at all.
Right. So
if you think you need to take action, what should you do? So important to know that from the age of 50, a man has a right to a PSA test. We don't have a screening programme in place because there isn't anything reliable enough to use. So testing, PSA test, which is a simple blood test, isn't completely reliable. It can throw up false negatives and false positives, but a GP has to give you the test if you want that after they've talked to you about the pros and cons of it. It's really important because if it throws up a positive, then you've got to think about what you want to do about it. And as we said earlier, often treatments can cause problems, and often the recommendation will be not to treat it but keep an eye on it. But it's as well to think about that before you actually have the test, so that you're not thrown into a shock. I do know from experience a lot of men just feel that they want to go for the surgery, get the prostate out, and it can cause, especially if a man's young, he's still got work to do, he's got kids to get through uni, he needs mortgages, needs insurances and things. If you don't need the treatment, it's best not to put yourself in that position. So think about it, but have the test if you need to, if you have a family history, if you're black, if you're over 50.
Right.
So what can you do? So if you're at high risk, as we've said, speak to your GP. We do know, unfortunately, some GPs try and persuade you not to have it. If you are worried, you feel you need a test, and you've a GP that's not too happy about it, or if you're not sure whether you need a test, or somebody that you know is resisting and you think that they really ought to be tested, or you've any questions about anything at all prostate related, Prostate Cancer UK have a specialist nurses helpline, and you can talk to them, you can email them, you can phone them. They will talk to you about anything prostate related, and really often help you choose what to do. I used to ring them when my husband was seriously ill, and we'd been to see the oncologist, and you always get outside, and on your way home you think, I wish I'd asked this. I'm not quite sure what this treatment means or what this medication might do. And you can't really go back. You know people are busy. You know the NHS is very busy. You don't want to trouble people. And the nurses helped me out on more than one occasion by just explaining what was happening. And even if it was bad news, I felt better knowing. And they really, really are experts. So never hesitate to contact them if you think you need to. And something that's really, really important, if you pick anything up from this presentation and you know somebody that may be helped by it, please, please, please share it. It's so important. What we have got, talking about risk and sharing it, is Prostate Cancer UK have a very quick and simple risk checker, which I will make sure Karl's got and can share it with you. It simply takes 30 seconds. It asks your age. It asks whether you have a family history that you know of. It asks whether you are a black man. And from that, it calculates your risk and directs you to pages of Prostate Cancer UK website to explain about it and what you should do about it. If you haven't got any risk at all, it asks you to pass it on. And it's very easy to share it by email or on social media. On the first couple of days that we had it, over 80,000 people took the test. And of that, over 80% were in a risk group. So during these difficult times when it's not as easy to get out there and talk to people, we've found it's an effective way of passing the information on. So if you can do that, be really, really grateful. Moving on now, COVID-19, GP surgeries and hospitals, we have heard, and Karl, you probably have more up-to-date information on this, because I know it's a quickly fast-changing situation at the moment.
Yeah.
But we have been over the last few months, we've been very aware that when men have gone to either GP surgeries or hospitals, they've been very confident that there's very strict infection control measures in place. They felt very safe. Recently, a urologist told me that he'd never felt safer performing surgery. So it's difficult times, difficult circumstances, but if you need any help, any appointments, the NHS is still there, it's still open for you. Important probably to say at this moment that we're very aware that over the last few months, a lot of men haven't had surgery or radiotherapy that they would have normally had due to the effects of COVID and backlogs, problems getting in for that surgery. That in a lot of cases have been given hormone therapy, which has helped or has actually managed to keep the cancer where it is at that time for a few months until surgery or radiotherapy's been able to be scheduled in and done. So there are options. I know men have told me that they've avoided, they don't want to be a nuisance, but just ask the question. It's quite possible that something can be done, and the hormone therapy, it may be injections, it may be tablets, but it is something that can be done to stop the cancer growing until something a little bit more permanent is done. So there's all sorts of things there. Please, if you feel you want to ask somebody, please ask and take the advice. Any questions now? Karl, have you any questions from that?
Yeah, a couple. I mean, I was really interested to hear about the effects in terms of different ethnic groups. You say it was black men. Are the gay community adversely affected as well, or is that just a rumour that I'd heard?
I don't believe there's any evidence that there's any difference. Certainly, anybody wanting information from the gay community, we actually have on Prostate Cancer UK website with a lot of material specifically there, and we have support groups as well, and they're good at the moment because obviously they're all operating by Zoom, so it doesn't matter where you live. Whereas when we used to have the physical support groups, unless you lived in the area, you couldn't go there. But good, and they're very popular. So there's lots more information than I personally know available through those groups. Again, the specialist nurses have the information, they have the knowledge, but really lots of information on the website as well. As with for black men, there's specific areas on the website, specifically for black men.
Yeah.
So
the other thing is there any dietary links in terms of I mean, I've heard people say, oh, if you eat a lot of tomatoes, that's good for your prostate. Is that just a fallacy? Or
it isn't. It is actually good, particularly cooked tomatoes.
Right. Okay.
So tomato sauce, pasta in tomato sauce. So it's generally, we would say, it's like with a lot of cancers, a good Mediterranean diet, exercise, fitness. It's actually a really good question because the three big risk factors, the age, ethnicity, and family history, there's nothing you can do anything about them. You've got them or you haven't. But diet and exercise, really, we don't know whether it would stop a man actually getting prostate cancer, but certainly it would help prevent it spreading, help give him the best possible chance to fight it. So it's really, really important, and it's about the only thing that you can do to either help yourself or help somebody close to you. Certainly, as I said, my husband died from it, but afterwards I was very concerned that maybe we could have done more, and I spoke to the doctors. It's that guilt feeling. Could I have done more? Why did he die when other men didn't? And I actually went and asked the doctors, and they said because he was so fit, and we had a really good diet, exercised properly, he wasn't a smoker, and we did everything that we thought was right, drank in moderation, and thought, why him? And they actually said that he probably got an extra 7 months just by nothing the medical teams could do, but because of his own, because of how fit he was and how he fought some of the treatments better than they thought he could do. So really, really important, and especially amongst the younger generation, to start soon enough. It's probably once you're diagnosed, it's hard to do anything at that stage, but really, really important.
Diet and exercise.
As with a lot of cancers, but particularly with there. So really good question.
Okay, thank you. The other thing, I mean, it was interesting because I've been through the checker myself, and I've got a family history. I'm over 50, so I actually rang my GPs this morning. I've got a telephone appointment in an hour. So I think, you know, we say about COVID slowing things up, but actually it can be speeded up in certain processes. So I think it's really, you know, it's something to bear in mind, isn't it?
That's really good to know. And I think as well, a lot of people are avoiding doctors unless they need to. And we heard at the start of lockdown about how A&E was empty because people used to go, stopped going.
But that's been really, really useful to me, and I'm hoping, and I'm sure it will be useful to a lot of our staff, and we'll certainly share this information with our staff. But on behalf of our trust, I'd like to really thank you, Janet, for for giving us this presentation, sharing this information with us, and as you said right at the beginning, if it can just save or help one person, that's worthwhile, isn't it?
It certainly is. Just before I go, just 2 points. Female relatives are very, very important in passing the message, so please continue to do so.
Okay.
And secondly, and I don't know how I forgot to say this, I never do, it's a very embarrassing thing that I used to find very embarrassing, but I know a lot of men don't go to the doctors. The test that you generally go into the doctors for is a simple blood test, but another test that doctors may do is what's called digital rectal examination, where the doctor actually feels up the back passage for the prostate. And I know from years of talks that puts men off of going. Men who've been say it's a little bit unpleasant, a little bit uncomfortable, it didn't hurt, and it was over with soon. And as so many men have told me that they've been told it possibly saved their life. So, no, sorry I missed that at the point.
No,
but just so long as we don't stop men going if they need to go. And thank you so much for giving me the opportunity, Karl.
Good. Thank you. And thanks, Janet. Thank you. Thanks. Okay. Bye-bye.
Bye.